Shock is a critical emergency topic on the NCLEX that you must master. It represents a life-threatening state requiring immediate recognition. At its core, shock occurs when the body fails to deliver enough oxygenated blood to sustain vital organs and tissues. When cells are deprived of oxygen, they begin to fail rapidly. If left untreated, this leads to systemic organ shutdown. The secret to answering NCLEX shock questions correctly is identifying the underlying cause. Understanding the mechanism is your first step. We will break down 4 major types of shock: hypovolemic, cardiogenic, septic, and anaphylactic. Let us begin with hypovolemic shock. Hypovolemic shock occurs when the body loses excessive blood or fluid volume. The heart simply lacks the volume to pump effectively. Common triggers include severe hemorrhage, dehydration, or deep burns. Vomiting and diarrhea can also lead to this dangerous state. Patients often present with low blood pressure and a rapid heart rate. You might notice weak pulses and cool, clammy skin. Watch for decreased urine output and flat neck veins. These are classic clinical indicators of a significant loss in circulating volume. The body attempts to compensate by constricting blood vessels. On the NCLEX, if you see fluid loss, immediately suspect hypovolemic shock. The priority nursing intervention is fluid replacement. Use IV fluids or blood products to restore circulation and improve tissue perfusion. Next, we examine cardiogenic shock. This occurs when the heart muscle fails to function as an effective pump for the body. Even if fluid volume is adequate, the heart is too damaged to move blood forward. Myocardial infarction is a frequent cause. Severe heart failure can also trigger this state. Unlike hypovolemic patients, these individuals often show signs of fluid overload. Clinical signs include chest pain and shortness of breath. Listen for crackles in the lungs, which indicate pulmonary edema. You may also observe jugular vein distension. The heart is struggling to move blood, causing a backup into the venous system. For NCLEX questions, remember that fluids alone will not fix cardiogenic shock. The problem is the failing pump, not the volume. Your priority is improving cardiac output. Carefully monitor fluid status to ensure you do not overwhelm the already struggling heart. Third, we look at septic shock. This is caused by a severe infection that triggers a massive, widespread inflammatory response. As inflammation spreads, blood vessels dilate uncontrollably. This causes blood pressure to plummet, depriving organs of necessary oxygen. Early in septic shock, patients often present with a fever. You might see warm, flushed skin along with a rapid heart rate. Look for bounding pulses in the early stages. However, as the condition worsens, the patient will begin to decline rapidly. Watch for hypotension and cool, mottled skin. Confusion and decreased urine output are signs that organ dysfunction is setting in. A major NCLEX clue for septic shock is an infection combined with unstable vitals. It is a race against time. Treatment priorities include rapid IV fluid resuscitation. You must also administer antibiotics and oxygen while monitoring for organ failure. Finally, we address anaphylactic shock. This is a severe, rapid allergic reaction triggered by food, medication, or insect stings. The immune system releases chemicals that cause immediate airway swelling. Widespread vasodilation also occurs throughout the body. Patients may experience wheezing and difficulty breathing. Hives and swelling of the face or throat are common visual indicators. Anxiety is often present as the patient struggles for air. This shock is dangerous because airway obstruction happens very quickly. On the NCLEX, airway is always the top priority in anaphylactic shock. You must act decisively to maintain a patent airway. The immediate treatment is epinephrine. Follow this with oxygen and aggressive airway support to stabilize the patient. To master these topics, always focus on the cause. Hypovolemic is fluid loss, while cardiogenic involves pump failure. Septic shock is driven by infection, and anaphylactic shock is an allergic reaction. Connect the symptoms to these specific problems. By linking clinical findings to the underlying cause, you can answer NCLEX questions with much greater confidence and accuracy. The NCLEX tests your ability to identify life-threatening situations quickly. Your goal is to prioritize care safely and effectively. Stay focused on the root cause of the shock. If you follow these principles, you will succeed on your nursing exam.